So this is about a 58-year-old gentleman who came from Mauritius. He had an accident around 1.5 years ago in his home country, in Mauritius, because of which he had a polytrauma. That means that he had multiple injuries. He had a fracture of the spine, he had multiple fracture of the ribs with the lung contusions, lung injuries, and then he had a very bad pelvic fracture. So there was a acetabulum fracture right about here, damaging all of his socket of the acetabulum, and the hip joint was all damaged, and the ball had actually gone inside, pushed inside into the bone. So he was in the ICU for a very long time, almost around 2 months. So he could not be operated at that time for his hip, but after around 1.5 months, he was shifted to somewhere in India, elsewhere, and his hip fracture was fixed nicely with the plates and everything. But in the long term, his hip developed arthritis because of the bad injury and the late fixation of the fracture. Now, when he came to us, he was barely able to stand and walk, only not more than a couple of steps, and he was in terrible pain, could not even turn in bed, could not put the foot down, and as you can see in the video, he was in real pain and misery. So we decided that the total hip replacement was the best option for him. Now, since he had this fracture and there was a lot of bone loss because of that, and there was a lot of metal work inside, so we anticipated that he may have problems in putting in a normal cup. So we were ready with all our armamentarium, all kinds of special equipment and implants. What we happened to use was a special cup inside, which is fully coated, which is uncemented, and it gives us options of putting in screws in multiple directions. It's called a multi-lock cup, and once put inside, it gives us an option of putting screws in various directions, trying to find the best quality bone available according to the condition of the patient. So now he's had a good recovery after this. 2 weeks after the surgery, he is walking very well, doesn't have any kind of pain. And after recovery of around 6 weeks with exercises and strengthening of the hip muscles, he should be able to walk completely normally without any limp as well. So this is a very good outcome, and thankfully we were able to help him. Thank you so much.